podcast. I'm Katie Meyer, VP of Education at APHA, and I'll be your host for this episode. Today, we'll be reviewing one of the new once-weekly insulins, insulin icodec, and compare it to once-daily insulin degludec in adults with type 2 diabetes. This topic has re-entered the chat as studies were originally published in 2023, but the manufacturer has now submitted their new drug application. We will key in on important takeaways for pharmacists to be aware of. But before we dive in, let me introduce our guests. Today, we're lucky to have an appy that contributed to this content, so we have three. Levi, Caitlin, and Io, please introduce yourselves.
Hi there, my name is Levi Abels. I'm a pharmacy student from Pacific University in Oregon, and I'm happy to be here today.
Hi everyone, my name is Caitlin Valentino. I am the Education Fellow here with APHA. Excited to be here.
And hi, my name is Io Adefioye, and I am the Advanced Education Fellow with APA.
All right, well, thanks so much for that. I am going to get started with Levi. So, Levi, can you provide a little bit of background about insulin icodec and its road to FDA approval for our listeners?
No problem. So, insulin icodec is an investigational basal insulin being developed by Novo Nordisk that is dosed once weekly, in contrast to the currently approved once daily injections such as insulin degludec. The new drug is a human insulin molecule that has been engineered for a longer duration. 3 amino acid substitutions were introduced to the original molecule that provide molecular stability, minimize enzymatic breakdown, and reduce clearance. Almost all of the drug that is administered fully binds to albumin in the blood, forming an active depot. From the albumin, icodec is slowly released into the blood, allowing for a glucose-lowering effect with a week-long duration. On September 29th of 2025, Novo Nordisk issued a press release stating that they have submitted a biologics license application to the FDA. The evidence for this new application is based on the results from the Onwards Phase 3A program, which comprises 5 randomized, active controlled, treat to target clinical trials in approximately 4,000 adults with type 2 diabetes. We'll go over the results of this study here in a moment. If approved, insulin icodec would become one of the first once-weekly basal insulins available in the United States, providing an alternative to daily basal insulin injections for adults living with type 2 diabetes.
Thank you so much for that background, Levi. All right, let's go to Io next. Io, can you walk us through the design of the Onward 3 and Onward 6 Phase 3 trials?
Of course, I'll start with Onwards 3, which evaluated insulin icodec in adults initiating insulin therapy. The trial enrolled insulin-naive adults with type 2 diabetes that required basal insulin initiation and were followed for 26 weeks, which was essential for evaluating an early glycemic response to the insulin. Once weekly icodec was compared with once daily degludec as the insulin basal reference. The primary endpoint was the change in A1C at baseline to week 26. Endpoints included fasting glucose, time when participants are in range, body weight change, insulin dose, and hypoglycemia safety. Onwards 3 assess whether weekly basal insulin can be appropriately used when initiating insulin in type 2 diabetes populations. Now, let's switch gears to Onward 6. This trial examined the use in a more intensive population setting. The trial enrolled adults with type 1 diabetes already using basal bolus therapy, and they were followed for 26 weeks as well. icodec was compared with once daily degludec, which was parallel to the Quint trials in episode 1. The primary endpoint was the same as Onwards 3, with the change in A1C at baseline to week 26, and secondary endpoints included fasting glucose, hypoglycemia, and glycemic variability. Onward 6 evaluates whether weekly basal insulin can maintain control in type 1 diabetes patients that are already familiar with daily therapy.
Great, Io. Thanks so much for reviewing those methods. All right, Caitlin, can you now tell listeners how did insulin icodec perform when compared to insulin degludec?
Sure, so in Onwards 3, 564 participants with type 2 diabetes completed the trial, and their mean hemoglobin A1C differences compared as observed at baseline to estimated at the end of the trial were found both non-inferior and superior to insulin degludec with p-values of less than 0.001 and equal to 0.002 respectively. There were no significant differences in the secondary endpoints of fasting plasma glucose from baseline, mean weekly insulin dose during the last 2 weeks, and body weight change from baseline. Level 2 hypoglycemic episodes, defined as clinically significant hypoglycemic events with a blood glucose of less than 54, were statistically significant from baseline to week 26 with a p-value of 0.01 and from baseline to week 31 with a p-value of 0.05. Combined levels of 2 and 3 hypoglycemia rates were statistically significant in the icodec group from week 0 to 26 with a p-value of 0.01 and numerically higher from week 0 to 31. In Onward 6, 582 participants with type 1 diabetes were randomized to receive insulin icodec or insulin degludec in combination with insulin aspart. The primary endpoint in this trial was the same as in Onwards 3, mean change in A1C from baseline to week 26 to test for non-inferiority. The secondary endpoints included change in fasting plasma glucose from baseline to week 26, percentage of time in range during weeks 22 to 26, change in diabetes treatment satisfaction questionnaire from baseline to week 26. There were no statistically significant differences found in fasting blood glucose time in range, time above range, and mean total weekly insulin dose, and body weight change as well. Time below range was statistically significantly higher with icodec than with degludec, with a confidence interval of 1.16 to 1.85. Estimated change in diabetes treatment satisfaction questionnaire increased from baseline in both groups. However, the change was statistically significantly higher with insulin degludec than with insulin icodec.
Thanks, Caitlin, for reviewing the efficacy results. All right, last but not least, Io, can you please review the key safety findings from these Onwards trials?
Yeah. So across the Onwards trial, the overall safety profile of icodec was generally aligned with degludec, but there were a few key differences that we should keep in mind. In Onwards 3, hypoglycemia rates were similar between icodec and degludec, but there were some weeks during early titration that showed higher hypoglycemic risk. In Onward 6, severe hypoglycemia occurred more frequently with icodec than with degludec. In both Onwards 3 and 6, clinically significant level 2 hypoglycemia and combined clinically significant and severe hypoglycemia levels 2 and 3 were statistically higher with icodec, both overall and with nocturnal episodes, with p-values less than 0.001 from baseline to week 26 and baseline to week 57. Injection site reactions were more common with icodec than with degludec. The reactions were mild and did not raise significant safety concerns, but should still be kept in mind when counseling patients. There was a noted increase in diabetic retinopathy events in the icodec group in Onwards 3, but this was not really observed in any other Onwards trials. Safety endpoints in these trials also included changes in body weight, weekly insulin dose requirements, and time spent above or below range. These parameters did not show concerning trends, but did reinforce the importance of starting low and go slow titration, especially in patients with type 1 diabetes. For this reason, regular glucose monitoring, especially during initiation and during the initial weeks of therapy, is essential, and follow-up appointments are critical to ensure patients are reaching a safe, steady state. So in summary, insulin icodec demonstrated a similar safety profile with degludec, but with higher rates of clinically significant and severe hypoglycemia, particularly in patients with type 1 diabetes. It also showed that there were more injection site reactions and retinopathy concerns in Onward 3. These findings emphasize the importance of individualized titration and close monitoring.
Thank you, Levi, Caitlin, and Io for such an insightful overview of this pipeline agent, insulin icodec. Let me summarize some key takeaways for our listeners. Two of the studies that were conducted to evaluate the safety of insulin icodec included Onwards 3 and Onwards 6. Onwards 3 evaluated insulin substantial experience with insulin in the past. In Onwards 3, mean A1C differences at the end of the 26 were found both non-inferior and superior to insulin degludec. In Onwards 6, A1C changes were numerically greater in the insulin degludec group, but insulin icodec was found non-inferior to insulin degludec, and non-inferiority was confirmed at week 52 as well. As far as safety goes, in Onwards 3, hypoglycemia rates were similar between icodec and degludec, but there were some weeks during early titration that showed higher hypoglycemia risk. In Onward 6, severe hypoglycemia occurred more frequently with icodec than with degludec. This is important when managing patients with those intensive insulin regimens. It will certainly be interesting to see what FDA decides on this pipeline agent, and I appreciate the three of you, Levi, Caitlin, and Io, reviewing the evidence today. And that is all we have time for today. If you didn't catch episode 1 this month, we reviewed similar data related to the other once-weekly pipeline agent, insulin efsitora alpha. These two agents have potential to reduce the injection burden in patients with diabetes, so it'll be important for us to stand by and see what the FDA decides on their approval. Don't forget to visit the Learning Library at learn.pharmacist.com to earn CE for this month's podcast. Take care, and thanks so much for listening.